Welcome to Focus on Crestview. I'm Karen Hardell, this year's president of the Crestview Area Chamber of Commerce, and our special guests today are with Covenant Hospice. Both Rachel Mayu and Carolyn Williams are community educators. And Rachel and Carolyn, I want to start with asking a few questions for our viewers about hospice. First of all, what is hospice?
That's a good place to start. I think there's still so many misconceptions about what hospice care offers and what we provide because it's still such a new concept in the U.S. In medieval times, hospice care were places for weary travelers or sick travelers to get rest and comfort. And the first hospice in the United States didn't begin until the late 70s. So now it's evolved into what we know it as today, where we offer the specialized symptom and pain management for patients who have been given a diagnosis with a terminal disease and have somewhere approximately 6 months to a year remaining to live. Covenant Hospice itself was founded in Pensacola in 1982, so we are proud to be celebrating our 30th year anniversary. And it started out with hospital leaders and volunteers who wanted to bring this special care to the citizens of its own community.
Well, you mentioned briefly who qualifies, but specifically, Carolyn, can you tell us who qualifies for hospice?
Oh, okay. Well, this is a great opportunity to talk about this because this is National Hospice Month, and Rachel and I enjoy any opportunity to get out and just share the information about hospice.
Well, we certainly appreciate you being here.
Thank you so much. Anyone, as Rachel says, with a life-limiting illness qualifies for hospice care. Hospice care is basically palliative care, and that is to have comfort measures. The patient and family, the doctor decides that it's no longer feasible to seek aggressive care or to carry on with the disease process as it is, and that the patient says, we just want comfort measures. We want to be in our home, surrounded by our family and our friends, those that love us, and we just want comfort measures so that we can just increase the quality of life. And so you have to live in our service area. Okay. Anyone can call us and refer or tell us about someone or ask questions. Inquire is the word really that I need to use about hospice. But in order for us to see the patient, we have to have an order from the doctor. Okay. Many people feel like, well, we may have to give up our doctor and we don't want to do that. You do not have to give up your primary care physician. We work with all of the physicians in our area. So we just have to have a life-limiting illness, and those illnesses consist of any end-stage disease such as COPD, end-stage COPD, end-stage renal disease, end-stage cardiac, AIDS, end-stage Alzheimer's, any of that with an Alzheimer, with a life-limiting ending would qualify you for hospice care. Okay. And that's really about.
Well, what is, you mentioned your service area. What is the service area for Covenant Hospice?
Oh, I'm so sorry. I was intending to go back to that. It would be Okaloosa, Walton counties. Now, Covenant Hospice is from many areas, from Alabama to down below Tallahassee, Florida. So everyone within their counties, we have branches that cover them. But in our area here, Niceville and Crestview covers both Walton and Okaloosa counties.
Okay, thank you. Yes. And an important question for you, Rachel, and that is, who pays for the Covenant Hospice care?
Yeah, well, admission to Covenant Hospice is truly based on the need of the patient, and that's because Covenant Hospice accepts patients regardless of their ability to pay. We are certified to receive reimbursement from Medicaid, Medicare, TRICARE, private insurance companies, and also on individual payment plans. We can set up a sliding scale if a patient has funds available. But if not, we take care of those patients regardless. Last year alone, Covenant Hospice provided $1.4 million in unfunded care to patients and their families, and that was done by receiving donations in the community, grants, gifts through our fundraising events. And it's just an honor for us, and we're so proud to be able to treat patients wherever they are and whatever the need is, that it's not based on the finances.
So money is not an issue.
That's right.
If you or a loved one needs hospice care, they'll receive it.
That's right. Covenant's here.
Yes. And I need to go back and add also to who qualifies that we go wherever the patient calls home. Okay. We go to their private area, their private home, or if they're in a nursing home setting, or if they're in an assisted living facility, we go there too. Okay. And we have been known to go even if someone is residing under a bridge. or in a field. We go wherever they call home. So just wanted to make sure we know that, so that someone not think that it's a place. Even though we do have the Joyce Goldenberg Center over in Pensacola for folks to go, and they do.
But they can receive hospice care in their home
in
or
their
wherever
home,
they are.
Wherever they are, that's where we go.
And that's a good segue, because the last question I have for this segment is, and who provides the care? Who is it that provides the hospice care?
We have a whole interdisciplinary team of care team that comes in, and it begins with the physician who writes the order, and then we have our medical director, who is Dr. Thigpen for the Crestview area, and we also have Dr. Thigpen, who is a part of our team, and he is able to go out to the homes if a patient is not able to go to the doctor. Well, he can go and visit that patient there in their home, and also if a patient comes and they need hospice care and they don't have their own provider, Dr. Fletcher is able to do that. But back to our team, we have the RN case manager who manages the care. We have our LPNs who are continuous care nurses. And if a patient has a symptom control problem, whether it's pain or agitation or whatever, she's able to go in and relieve that caregiver for up to 10, 12 hours, up to a 72-hour period.
My goodness.
And yes, and that's very helpful for someone that's at home taking care of someone. And you know, there's just the symptoms are not being controlled. So you have your hospice aides, and they go in and they do activities of daily living. They help with the bathing and with the dressing, and they can, you know, do little light work sometimes when they're there in the home, such as maybe making a sandwich or whatever. So they are very, very helpful, and they're just so loving and so kind. And we have our bereavement specialist that follows a family up to 12 months after a death has occurred in the home, has lost a loved one. And they call to check on them during holidays, because you're going to have the first of many, the first Thanksgiving without that loved one, the first Christmas without that loved one. And our bereavement specialist is there to assist them through those times. We have something called Coping with the Holidays that's going to be coming up really soon. And over in Walton County, we're going to do that on November the 9th. That'll be this Friday, starting 2 to 4. And then in Crestview, we're going to do it December the 1st at our office, and it's Coping with the Holidays. And we also have our chaplain. Our chaplain offers spiritual support, and that is so necessary whenever these times occur. And he is non-denominational. He doesn't go in and try to convert anyone or try to save anyone. He is there for their comfort, for their spiritual aspects of death and dying. We have, let me see, the social worker. She is so important. She is there. She is a wealth of knowledge and information and resources when she goes in the home. Every patient is assigned our social worker, and she does a fantastic job helping our patients. And I hope that I haven't left anyone out.
Well,
it's
we'll
like
have
the
another
whole
opportunity.
team. Yes. And our volunteers. Our volunteers, they are absolutely the heart of hospice. We love our volunteers. We have so many, and they work as patient and family volunteers. They are there to help the family. If someone needs to go to the store, or if someone needs someone to sit, or if they need someone to pick something up, they're able to do that. And then we have our administrative volunteers. They come into the office, help with the phones, filing, copying, and just helping us to get things prepared.
Well, when we come back, maybe we'll get a chance to tell everybody how they can volunteer. I know we have a lot of other information, but we do need to take a break.
Okay.
We'll take a break.
So enjoy these messages, and we'll be back in a few minutes.
Okay, thank you.